Kenya Civil Aviation Authority has already put on the spot 6 countries in a bid to safeguard Kenyans following the recent spike in the number of COVID-19 infections resulting from the new COVID-19 variants. And as our very own Raquel Muigai reports, the new measures come as the country continues to register a high number of infections.
Just days before the country marks 1 year since COVID-19 struck, the latest circular by the Kenya Civil Aviation Authority is telling of a situation that is still a formidable challenge for the country. It shows that it is not yet time for the country to let its guard down. Effective Monday, 8th March, travelers jetting into the country from Brunei, Czech Republic, Kuwait, Spain, Switzerland and Thailand will be required to undergo mandatory quarantine for 14 days upon arrival at their own cost. A decision that was arrived at based on the spike in the number of COVID-19 infections resulting from the new variants in the specific states. The World Health Organization saying the virus variants are powering another rise in infections across Europe. The Health Ministry in Spain had on Friday indicated that the UK variant could be behind as much as 90% of infections, Spain having detected not less than 50 cases of infections caused by the variants linked to South Africa and Brazil. The situation being dire in the Czech Republic, which this week registered a record-breaking total of nearly 8,500 patients hospitalized with COVID-19. With the Brazilian variant now present in 15 European countries and the South Africa variant, which is a source of particular concern because of doubts over whether the current vaccines are effective enough against it, being present in 26 European countries, WHO and its partners are working to strengthen the genetic surveillance needed to track variants across the continent as well as globally. In recent weeks, Kenya has recorded a high number of infections, with those in the medical field raising an alarm of what could be the third wave of the virus infections in the country. This week, the average positivity rate being 8%, the lowest being on 2nd March, where Kenya recorded a positivity rate of 6.2%, the highest being on 6th March, where it stood at 12.2%. 465 people have in the last 24 hours been recorded to have been infected with COVID-19 out of a sample size of 5,691. A positivity rate of 8.1%, raising the cumulative number of infections to 108,827. Additionally, 488 have been admitted in various facilities in the country, 69 among them being in the intensive care unit. Kenya has lost 2 people, raising the fatalities total to 1,876. With the vaccine campaign having barely scratched the surface of what remains to be the war against the virus, KCAA's recent circular is evidence that there is still a long way to go. Raquel Muigai, Citizen TV.